Phlebotomy Exam Prep 2006 20 Most Common Question and Answer explained. Order of draw. Standard order of draw. Mnemonic. Your boy Richard gives lovely gifts. Yellow, blood culture, light blue, sodium citrate, red gold, tiger, serum, SST, green, heparin, lavender, EDTA, gray, sodium fluoride. Questioned, a medical assistant needs to draw a CBC, PT&R, and a blood culture. What is the correct sequence? Answer. Application. Use the mnemonic to arrange them. Yellow culture, light blue, PT&R, then lavender, CBC.
Additives and tubes. Coagulation testing tube. Light blue tubes contain sodium citrate, which binds calcium reversibly to prevent clotting, must be filled completely to achieve the strict 9:1 blood to anticoagulant ratio. Question? A phlebotomist draws a PT test but fills the blue tube only halfway. What action will the laboratory take? Answer. Application. The sample will be rejected. An improper ratio skews coagulation times, providing invalid clinical results.
Additives and tubes. Hematology gold standard. Lavender tops contain EDTA, which preserves cell morphology, shape, and size by chelating binding calcium. Perfect for hematology testing like CBC, WBC count, and HbA1c. Question. Which tube should the technician select when a physician orders a white blood cell differential count? Answer. Application. Select the lavender top tube because EDTA preserves cell structures perfectly without causing cell distortion.
Additives and tubes. Glycolysis inhibition. Gray tops contain sodium fluoride, antiglycolytic agent, and potassium oxalate anticoagulant. Sodium fluoride stops cells from metabolizing eating glucose for up to 3 days. Question. A blood glucose specimen cannot be delivered to the lab for 4 hours. Which tube prevents the sample from degrading? Answer. Application. Select the gray tube. Sodium fluoride preserves glucose levels by putting a freeze on glycolysis.
Additives and tubes. Stat chemistry testing. Green tops contain heparin, lithium, or sodium, which inhibits thrombin formation. Because it prevents clotting, it yields plasma instantly upon centrifugation. Question. A doctor orders a stat electrolyte panel. Which collection tube allows for the fastest lab processing time? Answer. Application. Choose the green tube. It provides plasma immediately without waiting 30 minutes for a clot to form.
Order of draw the discard tube rule. When using a winged infusion set, butterfly needle, to draw a light blue tube, you must draw a clear red discard tube first to purge the air out of the tubing line. Question. When using a butterfly needle to draw a PT test as the sole tube, what is the crucial first step? Answer. Application. Draw a small amount into a discard tube first, so air in the tubing doesn't underfill the light blue tube and throw off the 9:1 ratio.
Lab operations. Serum versus plasma. Serum does not contain fibrinogen. It was entirely consumed to form the clot. Plasma contains fibrinogen because an anticoagulant kept the blood fluid. Question. After centrifuging a tube containing an anticoagulant, what is the liquid portion on top called? Answer. Application. Plasma, since the anticoagulant kept fibrinogen liquid in the fluid layer.
Venipuncture technique. Butterfly needle angle. Butterfly needles require a shallow 10 to 15 degree insertion angle. Standard multi-sample straight needles use a steeper 15 to 30 degree angle. Question. At what angle should a phlebotomist insert the needle when performing venipuncture on a shallow dorsal hand vein? Answer. Application. Look for 10 to 15 degrees, which is the standard protocol for shallow hand butterfly draws.
Venipuncture technique. Tourniquet maximum time. Maximum tourniquet application time is 1 minute, 60 seconds. Leaving it on longer causes hemoconcentration, pooling of large molecules and cells. Question. Leaving a tourniquet on for 3 minutes during a difficult draw will falsely elevate which laboratory analytes? Answer. Application. Potassium, total protein, and cholesterol will be falsely elevated due to hemoconcentration.
Order of draw. Microcollection, order, microcollection, capillary heel puncture. Order of draw is inverted. lavender EDTA first, followed by other additive tubes and serum SST tubes last. Question. During a capillary puncture on an infant, which microtube must be collected first? Answer. Application. Lavender EDTA. Platelets clump rapidly at capillary incision sites, so hematology specimens must be caught instantly.
Special populations. Infant heel stick boundary. Punctures must be on the far medial or lateral plantar surfaces of the heel. Never the center or back to avoid hitting the calcaneus bone. Question. A phlebotomist performs a heel stick on the central posterior curvature of a newborn's heel. What complication can occur? Answer. Application: osteomyelitis or osteochondritis, severe bone infection caused by the lancet contacting the calcaneus.
Special procedures: blood alcohol cleanse. Never use isopropyl alcohol to cleanse the site for a blood alcohol content back test. Use benzalkonium chloride BZK or plain soap and water. Question. A state trooper requests a legal blood alcohol draw. How should the phlebotomist prep the site? Answer. Application: cleanse with benzalkonium chloride to avoid cross-contaminating or artificially inflating the sample with topical alcohol.
Specimen handling. Light-sensitive analytes. Bilirubin, vitamin B6, and beta-carotene break down rapidly when exposed to ambient light. Wrap the tube in aluminum foil or use an amber transport tube. Question. An infant is under phototherapy for jaundice. Which precaution must be taken with their heel stick sample for bilirubin? Answer. Application: wrap the collection tube in foil immediately to protect the analyte from light degradation.
Specimen handling chilled specimen protocol. Ammonia, lactic acid, and arterial blood gases, ABGs, must be placed in an ice water slurry immediately after collection to halt metabolic processes. Question. A stat ammonia level is ordered. How should the sample be prepared and transported to the laboratory? Answer. Application: invert the tube immediately and submerge it completely in an ice water slurry to stop chemical breakdown.
Patient care and safety. Patient identification rule. Always use a 3-part verification system. Ask the patient to state their full name, date of birth, and visually match it to the requisition and wristband. Question. An inpatient is conscious but does not speak English. How should you positively verify their identity before drawing? Answer. Application: match the alphanumeric details on their ID hospital wristband exactly against the laboratory requisition form.
Specimen handling tube inversion numbers. Anticoagulant tubes require 8 to 10 immediate gentle figure 8 inversions. Light blue requires 3 to 4. Never shake a tube. Question. What is the primary consequence of shaking a lavender top tube vigorously after collection? Answer. Application: hemolysis, destruction of red blood cells, which will result in laboratory rejection of the sample.
Patient care and safety. Nerve damage warning sign. If a patient experiences a sharp, radiating, electric shock-like pain shooting down their arm, remove the needle immediately. Question. During venipuncture, a patient complains of sudden severe tingling shooting into their fingers. What action should you take? Answer. Application: terminate the draw immediately, withdraw the needle safely, and apply pressure. Do not attempt to adjust.
Legal and compliance. Chain of custody law required for forensic drug and DNA testing. Every single person handling the sample must sign and date a tracking log document. Question. A workplace drug screening sample is left unattended on a counter for 10 minutes. What must happen to the specimen? Answer. Application: it must be discarded and recollected because the strict chain of custody timeline was broken.
Anatomy and physiology. Basilic vein restriction. Order of vein preference in the antecubital fossa is 1. Median cubital, 2. Cephalic, 3. Basilic, the last resort due to anatomy risks. Question. Why is the basilic vein considered the least desirable choice for routine venipuncture selection? Answer. Application: it lies directly over the brachial artery and the median cutaneous nerve, drastically increasing injury risks.
Patient care and safety. Hematoma action plan. If a hematoma, swelling blood leakage, begins forming during a draw, release the tourniquet instantly, withdraw the needle, and apply heavy pressure. Question. During blood collection, the phlebotomist notices the skin swelling and turning purple around the needle site. What is the immediate priority? Answer: application. Pop the tourniquet off, withdraw the needle, and apply direct, firm pressure to the site. Thank you for watching. Please like and subscribe for more.